Hello everybody. So as Paddy said, our initiative was around marketing and the promotion of the Children and Young People's Palliative Hub. One of the pieces of feedback we've got through our network on the peer reviews and through our own networking within our group, that there was some lack of awareness around the hub and in particular around the Children's and Young People's Palliative Hub. So to start, I am going to give you some information just about the hub, and I have very aptly the pop-up behind me about the hub. So this is the main landing page of the hub. The hub, as everybody knows, there's many different aspects to it. There's looking at adults, it's looking at education, professional development, and for children and young peoples. Our focus is on the Children and Young People's Hub. It was driven really by a recognised need for more information, access to information for families and for professionals around children's palliative care within the all-island of Ireland. As Paddy said, it was launched in October 2014. The development of the hub was a collaborative approach between families of children with life-limiting conditions and healthcare professionals working in children's palliative care. So it was very much a collaborative approach. The main page of the Palliative Hub looks at the palliative journey for children and their families. And under each section, I won't go into the detail of each section, but under each section there are inputs from healthcare professionals, there are personal stories from families, and then there's links for relevant services or supports people may require. So each section is quite comprehensive with the inputs that are in it. Just as a general information, during the launch of the hub, there was a lot of work done around looking at media footage and newspaper clippings and ways of promoting the hub. And I have a short bit of footage for you to show to you that was used at that stage. Hopefully it will work.
A new website is being launched today for the parents of children with terminal illnesses. The site deals with all issues surrounding palliative care for kids.
The most difficult news a parent can get is that their child has a life-limiting illness. Sharon Thompson and her husband Brian were told in 2011 that their baby daughter Victoria was dying of a rare nerve condition. At home with her in Donegal, they searched for information.
Anything you find is through social media or networking yourself. This website is a very powerful tool, and we just hope now that at least it will be a positive force, and hopefully people will feel empowered.
Most sick children are being cared for at home. The new website is designed as a hub where their parents can access information about the journey ahead.
What parents need is information and knowledge about services, about what the experience is like, about what to expect, and about different stages of the journey they and their child and their family will go through.
Victoria spent the last 3 months of her life being cared for at the Laura Lynn Foundation. It has 8 beds and is the only dedicated children's hospice in Ireland.
The fact that it's the only one makes me very sad, because we have had such a great experience of palliative care, and I feel that Victoria's care was the best that it could be, and I feel that every child deserves that.
The new website is at www.cypph.com. It provides information for parents on the whole island of Ireland. Carroll Coleman, RTE.
So the website has changed since the URL, so it is now www.childrenspalliativehub.com. But otherwise the media footage gives you a very clear picture of what the hub is about and why it was developed. So our initiative aim, as we've already said, was about highlighting the Children and Young People's Palliative Hub as look at the target audiences for that, in particular for families with children with life-limiting conditions, to build the traffic and the engagement on the hub for it to be used as an information resource guide for families. The approach was we started looking at the stakeholders and who our key target audience would be, looking about how we would communicate the hub and what were the best channels of communication that we could use in trying to promote the hub, what were the key messages we could use to promote children and young people's palliative care, our activity plan, how we would look at a PR plan, which was a whole new area of work for our initiative. A lot of us are involved more in clinical care, so it was a new area to look around doing PR plans and media and communications. And then we looked about how we would communicate it to healthcare professionals, families and service users. We had extensive engagement and collaboration. We looked within the All-Island of Ireland, but we also looked to our colleagues in the UK, Together for Short Lives. We had initial collaboration and engagement with the marketing and communications lead in Together for Short Lives in the UK, which is an information resource and education resource for children and families, children with life-limiting conditions and their families and healthcare professionals. We also would have liaised with the marketing and communications people within Lower Lynn for some guidance, and to our colleagues in Northern Ireland Hospice. Also then we looked to the children's outreach nurses and other groups that were actively engaging with families with children with life-limiting conditions. I suppose another element of engagement as well that we haven't included on the screen here is that we had great engagement within our palliative care senior nursing network. Every time we met, we would have had peer reviews, and we got some fantastic, really constructive feedback from our colleagues during that helped inform us as we worked through our initiative. So our activities, we started looking at the traffic on the website as it was at the moment, and Gareth did some work for us looking at the hub, and it was very evident that the majority of traffic going through the hub, the children and young people's hub at the moment, is from the United States. So that was interesting for us to hear, and certainly our colleagues in the UK, Together for Short Lives, would have said the same, that the majority of their traffic was coming from further than their own national remit. We had asked Gareth if it could be identified as to where there was more healthcare professionals or more families accessing the hub. That wasn't possible to do. I know in the UK, again, Together for Short Lives are developing a new digital strategy at the moment, and that's one of the areas they're trying to see, to identify if families are actually using their information portals, or is it more healthcare professionals. We also looked then around our own engagement, our own teleconferencing, and again, as I said previously, liaising with our colleagues around the island of Ireland and into the UK. We looked at the distribution, so we were looking again at our stakeholders, who would be our target audiences, how we were going to send the information out, and who are the people that would disseminate it for us. And then we looked at some marketing strategies. So we were looking at different ideas for, how are we going to promote the hub? What kind of tools would we use? We looked at the use of fobs, but our colleagues in Northern Ireland were saying that there are data protection issues, and I think there's some issues around viruses or not being able to use the fobs. We looked at biros, and we had some really great ideas about some catchy biros that we could get that would have little flashing lights on the top of them, but they came back, the prototypes, and they were like disco balls on top of them. They weren't conducive to children. So in the end, we came up with the idea of using a magnet for families and pens for healthcare professionals. This is the magnet that we've developed. There was a lot of work that went in and a lot of learning from us as a team, because initially we kind of went ahead to develop what we thought would be a really good, catchy magnet to use, forgetting about the branding issues that have to go with it. So we learned a lot again from Karen in the All Ireland Institute around the importance of branding and maintaining the same branding as you go through. So we have developed this magnet that is really for healthcare professionals to share with families to have in their house, up in their kitchen or their fridge or their cooker or wherever, and it's really a prompt for them to remind them that this hub is there for them, and it is a portal of great information and support for them. We also developed pens for healthcare professionals to use. We know everybody loves pens, and everybody's always robbing their pens and losing their pens, so we have an amount of pens that we have developed as well, that again all have the hub's website on it, and so you can access information. So our distribution plan, we looked about the best ways of distributing these marketing tools that we have for the hub. We're doing developed postal packs, which are going out tomorrow. Out of that, we have identified throughout the island of Ireland all the kind of key contact people that we would have. So it's our adult and children's specialist palliative care teams, the community teams. We've looked to Northern Ireland Children's Hospice and Lower Lynn Children's Hospice around their family information packs, and including the magnets into their family information packs and the leaflets and brochures around the hub. We've looked to conferences and seminars for 2016, and how we've worked a bit with Kathleen and Carroll about how we can use these as opportunities in 2016 again to promote the Children and Young People's Palliative Hub. And then social media, it has been tweeted since the start of this afternoon about the launching of this and about the promotion of the Palliative Hub. So I would encourage everybody to go into, I think it is #Children'sPalliativeHub. and continue to use that. We have spoken a lot to Kathleen, and I have to say the support, I concur with everybody else who said it already, the support from Kathleen, Karen and Gareth has been really, really fantastic. We have consulted with them around the future development of the use of social media to promote this as well. So our budget was €3,000. I'm not going to go into it in detail. We haven't got a final sum yet because there are additional costs that we're waiting for around the leaflets. The leaflets were updated recently because of the change of the URL address for the Children's Palliative Hub. So there's new leaflets that have been produced. So at the moment we are just under €2,000, but that is expected to rise. But we will be well under our €3,000 budget. Taglines, we spoke about taglines. We haven't used them at this stage, but we've spoken to Karen and Kathleen about it, and we have been assured they will be used in the future. We looked at taglines that pick catchy phrases that people will hang on to or remember, because if there's something you can remember, Done Stores, Better Value, there was a few ideas that came out around learning from retail stores around how they've used taglines. So we developed 2 taglines. The first one is Children's Palliative Care Defined, look online. We'll bring you to the website, and then life-limiting illness, don't be in the wilderness, and log on to the website. So those are 2 taglines that I'm confident and I know that the Institute will use going forward when looking at promoting and building awareness of the information hub. So our key challenges, one of the first key challenges was identified to us by the marketing and communications team in Together for Short Lives. And it was around that the hub isn't a direct service provider. So if you're a family with a child recently diagnosed with a life-limiting condition, and you go to look for what you need, you're going to look for a service, not for an information guide. So that was one of the challenges identified to us by Together for Short Lives. Another challenge identified was that, again, if you're a parent and you're looking for support and guidance, if you Google for help, you're not going to Google palliative care because you don't think palliative care when your child has a new diagnosis. You're going to Google a very sick child or a gravely ill child, and that doesn't automatically bring you to the website. We haven't been able to master that during this initiative, but again, we've spoken to the Institute around looking at developing a digital strategy, which would include looking at the search words that could be linked to bring you into the website. There are changes to the URL for the hub during our initiative. So when we started our initiative, we were using the website CYPPH, and it has changed to Children's Palliative Hub. So that was a challenge for us in changing the layout of the marketing tools that we were going to use. We had, no different to everybody else, our time constraints and work commitments. Our all-island blend, unfortunately, our colleague from Northern Ireland wasn't able to continue with our group in the early stages, but we still had fantastic support from the Northern Ireland Children's and Adults Hospice and great guidance for them, so that was hugely beneficial. Geographically, we've learned a lot about teleconferencing and the challenges with that. And I suppose also within our group, we've had illnesses, we've had a pregnancy, we've had surgeries, we've had many changes within the group over the time, but that has really just made us a stronger team and challenged us to look at alternative ways of maintaining the contact and maintaining the momentum. The branding of our merchandise, as I said already, we had to be sure to keep in line with the current branding that's already established for the hub. And it was a huge new area of learning for us around looking at marketing and social media. Big learning. So our highlights and reflections is developing and building upon our professional networks. A lot of us in our initiative, because we were the only children's palliative care initiative group, so a lot of us had already had developed networks amongst ourselves, but we have certainly developed and further built upon those. The awareness of the Children and Young People Palliative Hub amongst the team of our own initiative, but also the wider team of the Palliative Care Senior Nurses Network. Our learning about marketing strategies, tweeting, we're not all there yet, but we're nearly there. The concept of a digital strategy, and that doesn't only, I suppose the whole learning about this is not only when you're looking at social media and marketing and PR, these are all strategies and tools that we've learned that we can apply to our everyday practice within our roles in palliative care, our own self-awareness and self-reflection in our professional roles and broader thinking. So the future, we're very fortunate within our initiative that there is already an established working group for the Children and Young People's Palliative Hub. It has representation of families and healthcare professionals on it. So the future is we've already linked in with the hub, but for us to present the work that we have done back to the steering group, to look at the targeted conferences and seminars for 2016, which again the Institute have committed to follow up for us, to do an evaluation and feed forward. Gareth has been monitoring traffic on the website up until now, and after today he will do a fresh monitoring of traffic on the website so we can see in a month's time if the traffic has changed on the website, so everybody go into it. Our digital strategy, again, I know it's something that the Institute are looking at as a digital and marketing strategy going forward, and certainly this is something that will be included on that, and the use of the taglines. And lastly, just to say thank you to the group. We had Maeve Hennessy from the Loud Specialist Palliative Care Services, Valerie Jennings from Crumlin, Booth from Laura Lynn, Leslie, who unfortunately can't be with us today, but I know is with us in spirit and mind, from Galway Hospice, myself, and Anne Mahoney from Marymount. Thank you.